when you look at stress research, we know that some mild to moderate stress is in fact good for us because it stimulates us, it gets us going. We respond in a positive way to moderate stress. But when you've got significant stress, one after another, building up day after day, then you find that anxiety levels can ratchet upwards and people can start feeling very uncomfortable about things. The big challenge with the pandemic is really one of loss of control. We've lost control of so many things in our lives that we thought we did control. We look around at the world, we cannot control the pandemic, or the numbers, or the mortality rate, or the admissions to hospital. We can't control the stock market or the economic news, or the closures of business on the high street. We can't even control the behavior of our fellow citizens, who for the most part behave well. But from time to time, we come across someone who doesn't obey social distancing or they don't wear masks, and that can be distressing as well. And so one of the first principles to bear in mind is try not to focus on those things that you can't control. Because if you do, you end up using a lot of emotional energy that you could put to better use elsewhere. And that becomes particularly important with the pandemic, where this is a long-running story. This is a long-running stressor. And you want to be able to conserve your emotional resources. And by focusing relentlessly on these negative things, what we term catastrophic thinking, you use up your fund of emotional energy. And so the catastrophic thinking refers to when you wake up in the morning and there's more bad news on the virus, or there's more bad economic news, or there's more bad political news, or the many other stressors that you would confront in your work as a journalist, which you tend to focus on. And so one negative thought runs into the next negative thought, and you get trapped in this pattern of catastrophic thinking. So you need to break that. And the first way to do that is to be aware of it. Be aware of catastrophic thinking and the degree to which it can use up your emotional resources. So having made a list of all those things that you can't control, shift your focus to those things that you are able to control. And they may sound small to you, but when they're taken collectively, cumulatively, over time they build up and they give you back a sense of controlling your life. And I would wager a bet that you're doing this already, that, we're 8-9 months into the pandemic and we've all come up with various coping strategies that work for us. But a well-tried and tested method is this. Make a list of those things that you can control. And let's start off with sleep. Sleep is extremely important. It nourishes us. When you wake up in the morning after a good night's sleep, you have better energy, you can focus on the day. Sleep obeys the circadian rhythm. Our body is trained to sleep at a certain time. It's linked to our levels of serum cortisol. When we wake up in the morning, serum cortisol levels are high. As the day goes on with the diurnal variation, the levels drop. By 10 or 11 o'clock at night, cortisol levels are low. We go to bed. We wake up the next morning and the levels are high again. They replenish. What's happened with the pandemic is because the structure has been lost in many of our lives, people's bedtimes start changing. You go to bed later. You don't have to wake up as early in the morning because you don't have to go into the office. And there's patterns that your body has become used to over the years get sacrificed. And sleep goes out the window and you start sleeping poorly. And this may be the same for other people that you're living with, children, etc. So sleep is extremely important. One of the things that I've said to journalists over the years, and I get a wry smile when I mention it, is try and disconnect from social media and your Twitter and your email before you go to bed. Because the last thing that you want to do before you reach for your bedside light to switch it off is to check your email or your Twitter, because if there's a message or there's something there that's going to interest you or worry you or distress you, it can prevent you from falling asleep. And your night can be a restless one. So, my recommendation is, 20 minutes, 30 minutes before you go to bed, just disconnect as much as you can from your devices. And I'm told repeatedly that this is how you lead your lives, that, your devices are so central to things. You've got to stay in touch with breaking news and things taking part, all the time, 24-hour news cycle. But I would tell you this, you are well served by turning off your device and going to bed. The other thing that you need to focus on is your nutrition. At a time of stress, people resort to comfort eating. If you're very busy and you're kind of bombarded by so many deadlines and so much work, you eat hurriedly, you order in fast food, and well-established eating habits go out the window as well. In the short term, you get by, but in the long term, it doesn't make you feel that great. The third thing that you should try and do, if you don't do it already, is some exercise. And even if the gyms are closed, there are some really good 5-10 minute workouts that you can see on the internet that you can build into your schedule each day. The fourth thing that is absolutely pivotal at a time like this with social distancing is you need to maintain your social contacts. You need to stay in contact with your colleagues. You're not going into bureaus, so you don't have that immediacy of contact. So stay in contact with your colleagues, with your friends, with your family. If you can't visit elderly parents, you need to stay in contact with them regularly. Good relationships are so important. They are protective from a mental health perspective. And at a time like this with social distancing, your energies may be elsewhere, maybe in your work or, the stresses of your job, and you can neglect those social contacts that are so important to you. You may want to schedule regular social contacts as well. The kind of energy that you put into your work should be the same kind of energy that you put into relationships and friendships. For people who live alone, who don't have a partner, this is a particularly difficult time because of social distancing. You're kind of cocooned or marooned in your apartment, and you don't have the kind of contact that you've come to expect in terms of your professional life or your social life. And so maintaining your social network at a time like this is absolutely pivotal. It's good for your emotional health. What you can see with my approach over here is that it becomes important to plan and structure your day. There's all those things that you can't control, but by bringing in planning and structure, and to a degree some routine, you start taking back this control. So if you, look after your sleep, if you eat healthily, if you exercise a couple of times a week, if you structure your social contacts with people via Zoom or whatever. The New York Times had an interesting article, the good old-fashioned telephone makes a comeback. Just by staying in contact with people via the telephone, you're putting good things into your day-to-day activities, you're giving some structure to your life that's not just work. Which brings me to my fifth point, and this is something that I borrowed from a letter to the New Yorker, the early days of the pandemic. A wise reader wrote in and said, respite is extremely important at a time like this. And it is. I think, for me, the pivotal message that I try and convey is this: when you're working so hard and so much of your work is stress and your workload has gone up, and it's not just the pandemic, but the multiple other stresses in your life, living and working at home, having a family at home, having your children at home, when all the structure of your usual life has gone out the window, at a stressful time like this, respite becomes extremely important. And respite as a form of resilience is a critical concept. And so what's good for your respite. What do you like doing? Socializing is a respite. Is it going to be exercise? Is it going for a walk? Is it doing yoga? A really great form of respite is mindfulness-based meditation. Mindfulness stress reduction is a very effective way of dealing with anxiety and down-regulating your stress. And so as part of the structure and the routine that you put into your life to take back control, you build in these moments of respite. You plan them. You will say a couple times a week, I am going to go for a walk. I'm going to exercise. I'm going to contact my friend. You build in these moments of respite. I'm going to listen to some music, whatever works for you. And what I found is this, that you can wake up in the morning with the best intentions and say, this is what I'm going to do. But then the day gets away from you. It becomes busy and you forget to do it. So my advice is a very simple technique: is start off your day with a blank piece of paper in front of you at your computer and write down on it your moment of respite for the day. What's going to be your activity or your respite for the day? Is it going to be your 10-15 minutes of mindfulness? Is it going to be going for a walk? And the point is that when you engage in your moment of respite, stay in the moment. That's critical. That's one of the principles of mindfulness. You learn to stay in the moment. It's no use going for a walk if your mind is going to be in your work, back in your study or your den. Or, if you're socializing with friends, but your mind is not on the activity, it's elsewhere. I've got this deadline to meet, I've got this, major story that's breaking, etc. One of the challenges is to use your moment of respite for true respite. Stay in the moment. And that's one of the principles of mindfulness. Getting back to mindfulness, there's some really excellent apps that are now available on mindfulness. And one that I like, which I've recommended to many of my patients, is called Calm, C-A-L-M. I think you pay a $60 a year subscription, and they've got particular modules for sleep, for stress reduction, Um, you know, you can pick and choose from a menu and they constantly refreshed. And it's a very effective way of building in your moment of respite. You know, you turn off your computer, you put your away message, you let your colleagues know, I'm going to be away from my desk for the next half an hour, and you go to a quiet place, you put your headphones on, and you do 20 minutes of mindfulness. And when you build in these moments of respite in your day, you know, day after day after day, you will start feeling the benefits after a couple of weeks. There's going to be no instant, you know, I feel great after one day. But when this becomes your pattern of behavior, this recurring pattern of behavior, your body will welcome it. Your mind will welcome it. If you miss a couple of days doing it, you know, you will feel it. And so it really involves this, you know, a determination on your part that I'm going to devote a part of the day to myself, not to my work, not to the news, not to all the responsibilities that come with your career right now, but some of that energy should be devoted towards yourself. And if you're able to do it, the benefits will become apparent after a couple of weeks or so. Remember this, that, you know, the pandemic is all consuming. And one of the traps that I've seen journalists get themselves into at a time like this is that you have a sense of inadequacy, that somehow you feel you're falling short because you could be doing more. And that's a common cognitive trap. You know, the pandemic is so big. There are so many things to write about, to investigate, that it's endless. You will never be able to cover everything. And if it's your construct, if it's your belief that you should be doing more because there's more to be done, it's really like, how long is a piece of string? You're just chasing something that you'll never get to the end of. And because you can't get there, you reflect back on yourself and you feel you're falling short somehow, that, you know, you're not doing what needs to be done at this extraordinary time. So be careful of that trap. It's actually very common, and I've seen it in many of your colleagues over the past 9 months. Finally, remember this, that at a time like this, it's normal to feel a little anxious and a little stressed. That's an entirely normal reaction to these extraordinary circumstances. But there are a couple of red lines that you should watch out for, that if you cross them, you should put your hand up and ask for help. If you find that your anxiety and your stress or your emotional difficulties are getting in your way of working effectively, that's one warning sign. If your emotional distress is impeding your relationships, if your relationships are starting to fray, that's another warning sign. And I would say to you, if this is happening, reach out for help. Because whatever you're feeling right now can be treated, and it can be treated successfully. And so this is a good segue into some data that I want to share with you before I conclude. So when the pandemic was, getting going back in early April, I was contacted by the Reuters Institute for the Study of Journalism at Oxford University, and a woman called Mira Selva said, "We know that you run a research lab at the University of Toronto. We know that you've done a number of journalism studies. Are you able to partner with us and look at how journalists have responded to the pandemic?" And so we did a study. We got very quick ethics permission, as you can now because of the pressing nature of this healthcare challenge. We got ethics approval within 3 days. Normally it takes us 2 to 3 months. You just show you how the works are just speeding up so quickly to get research done. And we got 2 large international news organizations to take part. And they opened up their Rolodex of journalists to us. And we were able to show that, as I told you earlier, the predominant emotion right now is anxiety. But we demonstrated, I think with a fair degree of robustness, that 25%, 1 in 4 journalists, had clinically significant anxiety. And 20%, 1 in 5 journalists, had clinically significant depression. These rates are very high. We're looking at something here called a point prevalence, a moment in time. When you look at the Canadian population and look at a 12-month prevalence or a lifetime prevalence, you will find that for depression, it's going to be way, way below that. For anxiety, way below that. So at this extraordinary moment in our history, there's an intensity of emotion that's translating into clinically significant anxiety and depression in a fair number of journalists. But there was some good news to the study, which is this. these big news organizations were offering therapy. And 52% of the journalists had made use of therapy during the pandemic. And the group that had reached out for counseling was significantly less anxious, less depressed, less psychologically distressed. And so, no surprise, therapy works. What kind of therapy? We don't know. We didn't record the kind of therapy. Sometimes it might just be some supportive therapy. It might be a session like we're having now that's repeated a couple of times, but the data are in and they're unequivocal and they're statistically very robust. That if you're feeling stressed at a time like this and you feel you need help, reach out for it, because that help can make a substantial difference to how you're feeling. And so the final point, this really is my final point before I take questions. If you are feeling stressed and anxious or depressed, or a combination of all of that, what you feel does not just stay with you. It can affect your partners, your spouse, your children, and your friends. We know that. If you're at home and we're all living these very constricted lives, and you're rubbing shoulders with people all the time, and you're irritable, or you're sad, and you're anxious, your family, your partner will pick up on it. It will affect them as well. And so, there's no mystery to it. If this is what you're feeling, get help. We are fortunate in Canada that we have access to help through a national healthcare system. And therapy works. It makes a difference. What you're giving voice to is, in essence, something called moral injury, which is that somehow you feel you're falling short in your role as a journalist, that there are people in front of you who are distressed. You may be interviewing bereaved people who've lost relatives from the pandemic or whatever it is. And so, there's a natural inclination on your part that you want to try and help that person feel better. And because you can't, you come away feeling dissatisfied and somehow, inadequate in terms of, what you've done. And, moral injury is actually very common. It's a sense somehow that you have betrayed your own moral code or your own moral compass by something that you did or something that you failed to do. And you can also get moral injury from observing the behavior of others and witnessing behavior that you feel has transgressed some moral code. And moral injury is actually very common in your profession. And it came to light in a study that we did 2 years back, looking at journalists covering the refugee crisis, where journalists were witnessing this huge migration of people across Europe who were in tremendous distress. They'd come from war zones, they'd lost everything, they'd suffered bereavement, etc. Refugees and real extremists. And journalists had a sense of, what can we do? We're not helping these people. There was a sense of inadequacy, which was moral injury. So your question is spot on at a time like this. But my message to you is this. You are not caregivers. You are not psychologists or psychiatrists or social workers. You are not trained in administering emotional help to people who are suffering. You are journalists whose job is to bear witness. And you fulfill a very important role in our society. You're one of the pillars of civil society because you keep society informed. And so I think it's essential at a time like this that you understand the importance of what you're doing as a journalist, the contribution you can make as a journalist in informing broader society of these events that affect us all. And when you do it to the best of your ability, you have done something that's very effective, that is one of the pillars of civil society. But when you transgress your role and you reach out through the goodness of your heart to try and alleviate the stress or ease the pain of people whom you're writing about or photographing, you're entering the slippery slope of, this is not your area. You are not going to be able to do it effectively. You're not going to succeed in this. And that becomes the conduit to moral injury, and moral injury can be associated typically with feelings of shame and guilt and sometimes anger. So be careful of it. I came across this in a Canadian context very strongly a few years back when I was speaking to journalists who were covering story, which is incredibly painful. And journalists would come away from interviewing the families of families who had lost women, daughters and wives that had gone missing. And the level of trauma and distress was so high linked to that. And, through a natural goodness of their heart, the journalists wanted to make a difference. They would, give telephone numbers, phone me if you're in difficulty, that kind of thing. And that was a slippery slope to loads and loads of problems. And so I think the best that you can do at a time like this is to do your work as a journalist as effectively as possible. And when you do it, you are making a significant contribution to society at large. I mean, it does go to what I spoke about earlier. I mean, you only have finite resources. And I'll say it again, there's an infinite number of stories linked to the pandemic, never mind the news outside of the pandemic. And there's been so many stressful events right now with Black Lives Matter and the whole question of, racism in society. From time to time, you're called on to cover, terribly violent events, mass shootings like they had out in the out east. And so you've got all these other things crowding in on you. And you have to say to yourself, there's only so much that I'm able to do. And your focus should be on doing that to the best of your ability. And remember, you need to build in your moments of respite, because there's a tendency at a time like this, when things are so intense, when there is so much to do, that you neglect yourself. And when you neglect yourself, you pay a price for that. You're not able to sustain it. I mean, early in my journalism work, soon after I began working with journalists, it was just after 9/11, and I was invited down to New York by CNN, a week after 9/11. They were worried about the journalists. We published a paper recently in the American Journal of Psychiatry, so they knew about me through my publication, and they said, can you come down to New York and just have a look and tell us, how are our journalists doing, because we're worried about them. And so I went down, and it was, it was a very sad time, a very stressful and difficult time. And so trauma was, very prominent. But I saw something else, which in time became in many ways more problematic. Journalists were being asked to work 16, 17-hour days. They were not taking weekends. Some of them were sleeping in the bureau. Such was the intensity of, the news. They were not socializing as they did before. They weren't spending proper time with their families. They were ordering, fast food because there was just no time to eat. They had stopped exercising. So all the kind of building blocks that we put into our life that sustain us outside of work were sacrificed because this was such a big story. And the pandemic has that same feel. And what I saw after 9/11 was that, as the days turned into weeks, some journalists couldn't sustain this pace. They started to become stressed and anxious. And I saw all these somatic symptoms, backache and headache and a bit of nausea. And you get all the physical difficulties starting to creep in, which are really somatic manifestations of stress. And the pandemic is very similar to that. In many ways, I think more challenging because it's going on for such a long time. And so you've got to be able to maintain your emotional resources because they're finite. And so coming back to your question, when you're faced with so many competing great stories, you have to say to yourself, I can't do it all. There's always going to be 1, 2, 3, 4 more stories that I'm never going to be able to get to. And so put your energies into doing the best possible job that you can with the story that you're working on. And then you'll be appreciated because then you're doing great journalism. And I think it behooves news managers to recognize this, to be able to say to their staff, we understand that this is, this is an unusual moment in time, that you're not able to cover all bases. And it's important for news managers to recognize the high quality of work that their staff are putting out. So you respond to what's being done with, acknowledgement or praise or encouragement, as opposed to saying, there's more work, why aren't you doing this? Because that's going to be a recipe for exhaustion. And I think, apathy is probably a reflection of the longevity of the crisis, of the story, coupled with the intensity of what you're being called on to do day after day after day. And that's why, respite as a form of resilience becomes so important. Because if you're able to step away from what you're doing and have your moments of respite, it will, in theory, refresh you. And so it becomes absolutely pivotal for you to build in your moments of respite. And you come back to what I said earlier, structure and planning become extremely important here. You know, you're very good at planning your story. How am I going to deal with this big news event? You're very good at doing that. But you also need to plan your day-to-day lives by building in these moments of respite. So I would encourage you to start off your day with this blank piece of paper and write out what your moment of respite is going to be for the day, and then have the strength to stick with it, because it's very easy to abandon it when the day gets hectic. But you have to say to yourself and repeatedly remind yourself that by taking your moment of respite, you're not compromising your work, you're strengthening your work. By devoting time to yourself, not to the story, you're strengthening your ability to work as a journalist. You have to turn things upside down, because your profession has this incredible work ethic, which is go, 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 24 hours a day for the 24-hour news cycle, 7 days a week. And it's very easy in response to that to become exhausted and to show some signs of apathy. So we come back to some really basic principles. It sounds very easy for me to tell you because, much harder to do. But, you're all determined individuals. You've all kind of risen up in your profession. You've got where you are through, the strength of your character and your drive and your ambition. So use those characteristics, those innate characteristics for yourself. Focus on yourself and don't feel bad doing it, because it's going to make you a more effective, happier, and healthier journalist. And remember, good journalism depends on healthy journalists. And so do it. Give it a shot and see. And don't expect to feel immediately better. It's going to take a bit of time for it to work through your system. But when this becomes your new way of living, it's a much healthier way to deal with things. And I would encourage news managers to convey what I'm telling you to your staff as well. Let your staff know that this is what they should be doing. That there isn't an expectation that you're going to be on call 24 hours a day and you're going to answer your email and your pager or whatever, or your Twitter account immediately. Just, step away from it. Put the away message up on your screen. I've gone for a walk. Don't bother me. Be back later, kind of thing. And just stick to it. Give it a try. And that's very distressing. I absolutely get that. But that is one of the variables you can't control. And you have to accept that, difficult as it is. And I think the surprise to many of us is perhaps how big that group is. That said, it's just one of those variables you can't control. You can't get caught up in arguments with them, because no matter what you say or what you do, you're not going to sway their opinion. And so, this also touches on this whole question of moral injury, because, it's a sense of moral hurt when you witness the behavior of other people that you feel has transgressed some kind of moral compass. So when people behave in this nasty, vicious way, when they send you, awful messages via email or whatever, when they troll you, that is behavior that can induce moral injury. It can make you cynical. It can, make you angry. It can bring out all these negative feelings, quite understandably, which are not good for you, because if that's going to be your, default emotion, you go around feeling angry and cynical and upset much of the time, which is clearly not good for your health, and it's not good for your work as a journalist. So you need to understand that, despite your best efforts, there's going to be a segment of the population at this moment in time. Our hope is that this will pass. But there is a segment of the population at this moment in time that will behave this way, no matter what you do. And you just get on with your work and you do it to the best of your ability. And my hope is that, if you're not an editor, your editor's telling you, or your boss is telling you that you're doing great work. They're acknowledging, what you're doing. You're getting positive feedback, which becomes a very important counterweight to the negativity that you would experience from those people who camp outside your office with their protests. But this is one of these extraordinary moments in time, which, so many negative forces seem to be coalescing at one moment. You're not going to be able to sway that as an individual. Collectively in time, I believe it will pass and we will overcome it. But it's going to take a lot of time. Yeah, I think it's going to vary from person to person, but I think the basic principle is you do need to unplug, because otherwise this becomes all-encompassing, all-embracing, and it just kind of takes over. So you may want to say to yourself, as part of your planning and your structure, I'm going to limit myself to a half an hour of the news a day. I'm going to watch a half an hour of the news at 9 or whatever you want to watch, and that's it. That's going to be me exposing myself to the news of the day. And then outside of that, I'm going to do other things. You know, and you can build in some other activities that's not news related. You know, journalists have said to me, well, you know, I've got to be constantly in touch with what's going on all the time because that's how I respond. And I say, no, you don't. You know, you need to be able to have your moments of respite. You cannot be on 24-hour call. Not even my profession as a physician can be on 24-hour call. You know, we all have our downtime. You know what, if you work in a large newsroom, what I've often said to people, if you feel that you've got to monitor things all the time, take shifts. You know, work like my medical practice. You take a shift. One person is on and the other 5 people are off. So you can go and have your moments of respite. If you're in a much smaller newsroom, that can be more challenging. But whatever it is, respite as a form of resilience, that's what you need to take away from the session, because that's going to get you through the duration of this pandemic and the pressures that come with it with your profession. That's essential. You know, it's always my hope that when we do sessions like this, that managers join us and listen to this discussion, because the message needs to work its way through the entire news organization. It shouldn't just be, you know, people who are kind of doing the day-to-day reporting. I mean, the managers need to hear this message, because this needs to be a culture that permeates a news organization. You cannot have people who stand outside the principles that I'm putting across to you, because then it becomes certainly a lot more challenging. I think, you know, education can help people change their minds. And if you have a sense that you're reporting to a boss who just doesn't get it, who's kind of relentlessly pushing you to do more and more, it's quite useful to share the tip sheet that I'm going to send to Sarah after this with your boss and say, hey, you know, have a look at this. You know, we had a session with this guy in Toronto. He's been studying journalists for 20 years. You know, we think he gets it. Why don't you have a look at this? Because, you know, for us on the ground, this makes perfect sense. And, you know, try and share these ideas as the first step. If that doesn't help, you know, sometimes you're just going to be dealing with difficult people. No matter what you do, you're not going to be able to sway them. From a personal level, if you are feeling, I need to take a break, I would encourage you to do it. I think, you know, your news organization has a moral obligation to look after you as a journalist. You know, if you slipped on some ice going into your bureau and you broke a leg, no one would think twice about calling an ambulance, taking you to the emergency room, and getting your leg put into a plaster cast. But when it comes to mental health, somehow it's a different playing field, you know, and that's wrong. You know, that's a false dichotomy. And so, you know, I would encourage you that if you're feeling stressed, if you need some time out, you know, you would say to your manager, you know, I'm not feeling right. I need to take a break. I've put in my hours over the last 9 months, and, you know, I'm giving you notice that I'm going to be doing it. You need to have that strength to be able to do that. I believe that management would acknowledge that for the most part, and you know, and you can go off and take your break. I can't speak for everyone, of course. From time to time, you do come across hard-boiled individuals who don't buy into this message. And it makes it obviously much more difficult for journalists to function in an environment like that. That said, increasingly, my sense is news organizations get what I'm saying. And at a time like this, during the pandemic, where there's so much that's been written about psychological well-being, you really have to have a tin ear or be tone deaf to miss this message. And I would advise you, you know, once a week, once every 2 weeks, just, you know, when you're having a conversation with someone, just to say, you know, we know this is a stressful time, this is a difficult time, you know, how are you doing? You can also couch it with, you know, I think you're doing great work. You know, the last 2 weeks have been really intense and you've written some wonderful stories, you've taken some great photographs. And then the same thing, you know, say, well, you know, some people find life difficult right now. How are you managing? Are you okay? Just something as simple as that, you know, and let them know that, you know, we take your welfare seriously. And if there's something that's troubling you, please feel free to reach out, because within our organization, we think this is really important. And you can, you know, if someone does reach out to you, the first thing you let them know, this is strictly confidential. You know, I'm not going to be your therapist. I'm not here to help you with your mental health difficulties, but I can be the conduit that will get you to see someone who can help you. And then you step back, and then you've done your job. And so I think, just by raising this from time to time in your conversation with them in a pretty low-key way will really be appreciated. And you can do it in the context of also acknowledging the great work that they're doing. So, you can kind of combine multiple things at one time. Mild to moderate stress can be a positive factor in our lives because it becomes a spur to action. It makes us do things. But when you have one stress after another, and they are not moderate, they are significant stresses, the threat of losing a job, losing a livelihood, against the backdrop of this pandemic, then, you can understand why anxiety levels are ratchet upwards, why they become so high. And so you do have this extraordinary confluence of circumstances right now for your profession, which you have all this job uncertainty at a time in which you've never been asked to work harder on a story that's never been more stressful against the backdrop of so much misery and difficulties in our societies. So it's almost like this perfect storm. And so you have to be so careful of not slipping into what we call this catastrophic way of thinking, that you're focusing on all these negative things that you just can't control. You're not going to be able to control whether your newsroom is going to offer you the contract next year, or that's something that right now is beyond your control. Just like the pandemic on the individual level is beyond our control, or the behavior of fellow citizens beyond our control. So you have to focus on what can I control? And we come back to those things. So through structure and planning, well, I can try and control my sleep and what I eat and what I exercise and my social contacts, my moments of respite. And you focus on that. And I can control working to the best of my ability and putting out a good product, because you fulfill such an important part in our society. And that's what you've got to focus on. Hard as it is, it's very difficult because you've got all these anxieties swirling around in the background. And if you find these anxieties are intruding and impeding on your life and your quality of life, then, try mindfulness. Try some mindfulness-based stress reduction to help you. If that doesn't work, if the app doesn't work, put your hand up and go and see someone for a couple of sessions, because, we've got data now to show it makes a difference. It helps. It's not going to take away the uncertainty of your work and the precarious nature of life as a journalist, but it gives you a way of managing that precarious aspect of your life. And that's so important. I'm a big fan of mindfulness-based stress reduction, which I think is really, in a sense, the therapy for our times. And there's some really good apps. As I said, the one that I've recommended and I use myself is called Calm, which I find really very helpful. And so look at it, but there are going to be others. There are going to be others that are freely available. I think Calm, you pay $70 a month, $70 a year. But the others that are going to be free, in which you can learn the mindfulness-based techniques. And you bring that in as your moment of respite, and you use them regularly. The other thing is this, if you feel you need to speak to a therapist, reach out to your general practitioner, because GP practices have a network of people that they refer to. And some practices indeed have therapists attached to their practice. And so you may be able to get access to a therapist that way. A lot of therapy, of course, now is remote, it's virtual. So you're not going to be seeing the person, you're going to be working the way we're working now. So even if you're living in a small remote area where, historically there's always a shortage of mental health resources, at a time like this, you can still access a therapist in Toronto through technology. So that's one of the ways that healthcare is going to be transformed, by the way. The pandemic is going to fundamentally transform the way my profession works, which, the in-person assessment is going to be much, much less popular when the pandemic is over. And you witness people suffering and their distress, and it affects you, and it stays with you, but you're reluctant to reach out for help because you say to yourself, what right do I have to complain when the person that I've reported on has something that's so much worse? And, I've come across this also repeatedly. This is an argument that people give me why they don't reach out for therapy. And, my response is, there is no equivalence. We're not stating that, distress is the same for each person. Yes, of course, the person who has lost a relative from the pandemic, who wasn't there with a relative who died in isolation, You know, your distress is not equivalent to that. But that doesn't mean you should negate your own feelings. And so, you know, the argument that I give once again comes back to physical medicine, which is this. You know, if you break a leg and you go into hospital and the person lying in the bed next to you has broken two legs, you don't kind of hop out of bed and hobble out the hospital. You know, you get your leg attended to. And it's the same with emotional difficulties. Yes, the people that you report on indeed have things much worse than you in many cases. But that doesn't mean your feelings are somehow invalidated by that. If you are struggling emotionally, get some assistance, because the therapy can be effective. It doesn't have to be prolonged, and it will make you feel better. And it will make people who you associate with feel better as well, because you're feeling better. So it's a pretty compelling argument why you should do this.